Hi, my name is Letitia, and I am one of the mental health trainers here at BioQuest. Today, I have the privilege on guiding you through your training on understanding PTSD. Your objectives for today are to be able to identify signs and symptoms with clients experiencing PTSD, to increase your knowledge of how to screen for PTSD when working with clients and their families, to become knowledgeable of the leading causes of PTSD, and better intervene with clients experiencing PTSD. And then lastly, learn how to successfully help your clients cope with PTSD. So let's start off by looking at what is PTSD. Post traumatic stress disorder is a mental health condition that develops after experiencing or witnessing a traumatic event, such as a natural disaster, war, or a violent crime. These stressful traumatic events usually involve a situation where someone's life has been threatened or severe injury has occurred. People with PTSD may relive the trauma in painful recollections, flashbacks, or recurrent dreams or nightmares. They may avoid activities or places that recall traumatic events or experience physiological arousal, leading to symptoms such as an exaggerated startle response, disturbed sleep, and difficulty in concentrating or remembering things. Some people may have guilt about surviving trauma when others were not able to survive their trauma. So, what are some causes of PTSD? Some people develop new or more severe signs months or even years after a traumatic event. PTSD is often related to the seriousness of the trauma, whether the trauma was repeated or not, what the individual's proximity to the trauma was, and what their relationship is with the victim or the perpetrator of the trauma. An estimated 1 in 11 Americans will be diagnosed with PTSD in their lifetime. According to the World Health Organization, about 70% of people globally are going to experience a potentially traumatic event in their lifetime, but only a minority of those will actually go on to develop PTSD. However, that still means an estimated 3.9% of the world population has experienced PTSD at some point in their lives. So here we have some potential causes of PTSD. We have combat and military experiences where you're going to see soldiers exposed to combat situations, war zones, or other dangerous military operations, which can cause PTSD. Physical or sexual assault, including domestic violence or childhood abuse. Natural disasters, which can include individuals who have experienced or survived natural disasters such as earthquakes, hurricanes, floods, or wildfires. Serious accidents such as car accidents, plane crashes, things like that. Medical trauma, where we're looking at patients who have undergone traumatic medical procedures. Maybe they've experienced life threatening illnesses or faced significant medical emergencies. Witnessing violence. So, people who have witnessed violence or a traumatic event, even if they were not directly involved in the situation, they can still experience PTSD. Loss of a loved one, the sudden or unexpected loss of a loved one can lead to traumatic stress. First responders, like police officers, firefighters, emergency medical personnel, and other first responders can develop PTSD from exposure to traumatic events. Post traumatic stress disorder can be classified into several types based on the duration, severity, and the nature of the trauma experienced. However, today we will cover 4 types of PTSD. The 4 types we will be covering today are acute, chronic, delayed onset, and complex PTSD. Let's start off with acute PTSD, as this is the most common type of PTSD. So, this is also known as acute stress disorder or ASD. So, ASD is a mental health problem that can occur in the first month after a traumatic event. Acute trauma results from a single incident. Symptoms of acute post traumatic stress disorder can include flashbacks, avoidance of reminders of the trauma, and increased arousal. Flashbacks can be vivid and feel like the trauma is happening again for the person. Avoidance can involve avoiding people, avoiding places, or even situations that trigger memories of the trauma. Increased arousal can manifest as difficulty sleeping, irritability, and hypervigilance. The Diagnostic and Statistical Manual of Mental Disorders, or the DSM-5, states that acute stress disorder is diagnosed when a person has been exposed to a traumatic event and experiences at least 9 symptoms from the 5 categories. So the 5 categories are intrusion, negative mood, disassociation, avoidance, and arousal. Remember, the symptoms begin within 4 weeks of the trauma and last for at least 3 days up to 1 month. The reaction caused by this significant distress or impairment in social, occupational, or other important areas of functioning. Now let's look at chronic PTSD. Chronic trauma is repeated and prolonged, such as domestic violence or abuse. The word chronic itself refers to something that keeps recurring or has persisted over a long period. Chronic PTSD is an ongoing condition after a shocking or a distressing event. Examples would include bullying, chronic medical illness with invasive medical procedures, homelessness, neglect, starvation or deprivation, ongoing war or combat, and witnessing constant abuse of a partner or a family member. Chronic PTSD is a longer lasting form of the disorder that occurs when symptoms last for more than 3 months. While it's not unusual to experience emotions like shock, fear, or increased anxiety after an upsetting event, these feelings usually lessen as time goes on. Chronic PTSD causes people to experience intense feelings over a long period. Clients with chronic PTSD may have more severe and persistent symptoms, including difficulty with relationships, work, and daily activities. While sometimes referred to as delayed onset PTSD, the technical definition is PTSD with delayed expression. PTSD is considered delayed if symptoms do not appear for at least 6 months following a traumatic event. In some cases, it can even take years for a trauma response to develop. This type of PTSD can be more challenging to diagnose and to treat because the delay in onset can make it difficult to link the symptoms to the traumatic event. Delayed onset PTSD of this type has mostly been observed among the elderly because they may develop PTSD stemming from a traumatic event that occurred when they were much younger. So, for example, one study of World War II veterans found that many people had a worsening of their PTSD symptoms or the development of delayed onset PTSD much later in life. Almost half of the veterans indicated that the worsening of their symptoms was triggered by major life changes, such as losing a job or losing someone close to them. The last type we will discuss today is complex post traumatic stress disorder, or CPTSD. This is a mental health condition that can develop if you experience chronic trauma. This is a type of PTSD that can occur after prolonged or repeated exposure to trauma, such as abuse or even captivity. Complex trauma is exposure to varied and multiple traumatic events, often of an invasive interpersonal nature. Clients with CPTSD, they may have a range of symptoms like those of other types of PTSD, but they may also have additional symptoms such as difficulty with self-perception, distorted beliefs about self or others, problems with emotion regulation, feeling very angry or distrustful towards the world. They may constantly have feelings of emptiness or hopelessness, feeling as if they are permanently damaged or if they're worthless, or even persistent difficulties in sustaining relationships. Now, it's important to note that not everyone who experiences a traumatic event will develop PTSD. Many clients can actually cope with trauma and move on with their lives without experiencing long term symptoms. However, for those who do develop PTSD, treatment can be highly effective and can help to reduce or even to eliminate symptoms. Let's look at signs and symptoms. According to the DSM-5, to be diagnosed with PTSD, a person must have all the following criteria for at least 1 month. First, we have the person must experience a stressor where the person directly experienced or has been exposed to an event where there was some sort of a threat of death, serious injury, or sexual violence. There must be some form of intrusion where the traumatic event is persistently re experienced, like nightmares or flashbacks. Avoidance. So, this is meaning where there is persistent, effortful avoidance of distressing trauma related reminders after the event. There have to be negative alterations in mood, alterations in cognition and mood that begin or worsen after the traumatic event. Um, we're going to have to see alterations in arousal and reactivity. So, changes in how a person's body and mind react to stimuli and situations following a traumatic event. They're going to look at the duration or how long the person experiences the symptoms. So, the symptoms experienced after a traumatic event, they need to persist for at least 1 month. Functional significance. So symptoms must cause clinically significant distress or functional impairment in one or more area of a person's life. And then lastly, they need to be able to exclude some exclusion. So symptoms must not be due to a medication that a person is taking. It can't be due to any type of substance use or any other illness. According to the DSM-5, PTSD is characterized by 4 major symptom clusters. Um, and these 4 major symptom clusters are going to follow an event that elicited some sort of fear, helplessness, or horror. So the 4 main symptoms to PTSD are re-experiencing, avoidance, hyperarousal, and alterations in thought and mood. So we're going to break that down, but first we're going to watch a video.
Post-traumatic stress disorder, or PTSD, is a mental health disorder that results from experiencing a traumatic event. This includes any event that is experienced personally, witnessed, or learned about that causes feelings of extreme fear, helplessness, or horror. Examples include experiencing a natural disaster, a serious accident, war, rape, or other violent personal assaults. It is not uncommon for one to experience a trauma. According to the National Center for PTSD, about 60% of men and 50% of women experience at least one incidence of trauma in their lives. Nearly everyone who experiences a traumatic event will have temporary difficulty adjusting and coping, and may experience PTSD symptoms for a period of time. However, over time, a process of recovery occurs naturally, and PTSD symptoms resolve on their own. For others, however, the symptoms persist and become interfering and distressing. PTSD is diagnosed when the symptoms last for at least 1 month. The symptoms are organized into 4 clusters. While I'll discuss the different clusters briefly, it's also important to understand how they might look all together, as they reinforce each other to maintain PTSD over time. The first cluster involves re-experiencing the trauma in any of several ways. One way is through memories that intrude on someone in an unwanted way, coming to someone's mind when they don't want them to. Sometimes these memories are experienced so vividly that the person experiences a reliving of the trauma. That is, seeing, hearing, smelling, tasting, or feeling the same sensations they did during the traumatic experience. This is called a flashback. This is very different from thinking or ruminating about something. Another way is through experiencing nightmares or by having intense emotional or physical reactions when somebody is reminded of their trauma. Since these symptoms can be quite distressing, when they are repeatedly experienced, an understandable reaction to them is to try to avoid them. People might try to avoid the memories by pushing them away, not talking about them, or keeping busy to distract themselves from them. They may avoid the emotions associated with the trauma by shutting down, meaning they try not to feel any emotions. They may also try to avoid reminders, such as people, places, or situations that remind them of their traumatic event. It is important to understand that avoidance is an understandable strategy to help manage symptoms, and it might work in the short term. However, over time, it actually prevents one from recovering. For example, the more one tries to push memories away, the more they will intrude on their mind, and the less control they'll have over the memories. Let's take an example. I'd like you to think about anything right now, anything at all, except for a dancing panda bear. Think about anything at all except for that bear. What do you notice? Likely you're thinking about the bear, or at least trying really hard not to think about the bear, which is making it difficult to think about anything else. In PTSD, as avoidance strategies become less effective over time, one might increase their use to continue to try to manage symptoms. Unfortunately, many of these avoidance strategies, like withdrawing from people, using substances, being aggressive, become problems in their own right that worsen over time. A third cluster of symptoms concerns negative changes in thoughts and mood. After experiencing a trauma, one might develop negative beliefs about themselves, such as, I am a bad person, or it is my fault that it happened. Negative beliefs about other people, such as nobody can be trusted, or negative beliefs about the world, such as the world is dangerous. When someone avoids social contact and other situations, these beliefs tend to become stronger, and they lead to persistent negative emotions, such as fear, shame, guilt, anger, or sadness. The last cluster of symptoms are called hyperarousal symptoms. These include hypervigilance, in which one feels constantly on guard and watchful, irritability or anger outbursts, difficulty sleeping, difficulty concentrating, having an exaggerated startle response, and participation in unhealthy or risky behaviors. As I said earlier, it is helpful to understand how these different clusters of symptoms interact and reinforce one another. For example, if someone is experiencing painful, intrusive memories about a trauma, they may begin to avoid the memories and emotions associated with the trauma. This in turn leads to feelings of emotional detachment that cause the memories to intrude even more. To try to reduce being triggered by reminders, one might start to avoid certain places or things, such as crowded areas or dark rooms. The more one avoids contact with their environment, the stronger their negative beliefs about themselves, such as I can't handle it, and their beliefs about the world, such as if I go out, something bad will happen. The stronger those beliefs become, and the more intense their negative mood becomes.
Okay, let's break those clusters down. So, first we have re experiencing PTSD. Clients can have sudden and unwanted traumatic memories that intrude into or even start to replace what is currently happening in their life. Some clients have constant negative thoughts about their experience. They may repeatedly ask themselves questions that prevent them from coming to terms with the event. Flashbacks, nightmares, and bad memories are just examples of re experiencing symptoms. These symptoms, particularly the flashbacks, can also have physical effects, such as rapid heartbeat, sweating, or even trembling, which will be the same reactions that people experienced during the original trauma. The next main symptom of PTSD is avoidance. Avoidance is one of the most common symptoms of PTSD. It's common to want to avoid things that remind a person of a traumatic event. However, it can significantly affect a person's quality of life, making it harder for them to recover. Avoidance can seem like a helpful behavior to people living with PTSD because it allows them to avoid uncomfortable or distressing emotions or situations. The behavior of avoidance can manifest in multiple ways, such as behavioral or emotional avoidance. With behavioral avoidance, persons can avoid places, people, or activities that remind them of the trauma. They may change their daily routines to avoid triggers or even engage in using substances like alcohol and drugs to numb emotions. Avoidance in PTSD has several negative consequences, including a lack of emotional processing, which prevents recovery and can make symptoms worsen over time. If a person goes through a traumatic event, They may have heard advice such as just try not to think about it or don't worry about it, time heals all wounds. However, if a person goes out of their way to avoid thoughts, feelings, and reminders related to a traumatic event, their symptoms could potentially get worse. It reinforces fear, it increases anxiety, and it can lead to a narrow minded emotional range or emotional numbness. This can also damage self efficacy, lead to social isolation, and increase the risk of other issues like depression and substance use. Hyperarousal is the third significant symptom associated with PTSD. It's a state of heightened anxiety and awareness stemming from an overstimulation of the body's stress response. This can manifest in various ways, including difficulty concentrating, sleep disturbances, and physical symptoms like increased heart rate that occurs even when there is no longer a threat present. Hyperarousal can be characterized as cognitive, where a person can have difficulty concentrating or focusing. You could see hypervigilance, experiencing intrusive thoughts, or difficulty sleeping or nightmares. It can be characterized as emotional, where you will see increased irritability, anger, anxiety, and fear. The person may feel like they're constantly on edge or as if they're like keyed up, and they could have difficulty regulating their emotions. It can be characterized as physiological. So, this is when a person will experience an increased heart rate or blood pressure. They can see some sweating and trembling. They could have muscle tension and aches, or even difficulty falling asleep. Or when they do fall asleep, maybe they're not able to stay asleep. And then lastly, it can be characterized as behavioral. So here there will be avoidance of reminders of the trauma, hyperactivity, or impulsivity. Um, they could have difficulty controlling anger or aggression and difficulty with relationships and social interactions. The last of the four main symptoms of PTSD is alterations in thought and mood. This can include negative beliefs about oneself or the world, persistent feelings of fear, anger, shame, and difficulty experiencing positive emotions. Other changes involve memory problems, a persistent inability to recall parts of the traumatic event, a distorted sense of blame for the event, and a sense of detachment from others. These changes often disrupt a person's daily life, and they can include a loss of interest in once enjoyed activities. So this can manifest as difficulty concentrating, negative thoughts about, again, oneself or the world, ongoing negative emotions like the fear or the anger. The individual might also experience a detachment from their own body, which is depersonalization, or they may experience a detachment from the surrounding world, which is derealization. Now let's discuss, is trauma subjective or objective? Traumatic experiences can be divided into two components. We can have objective or subjective. So the objectives are the events that result in the trauma, while the subjective is how the individual experiences those events. So for example, two people can be involved in a car accident where they were severely injured. Um, Within that car accident. Now, one of the individuals, they may drive themselves home from the hospital, while the other person, they may not want to get into a car again for weeks. Or maybe they don't want to drive at all. They may be triggered even seeing a car that's the same color of the car that hit them. Or they may be triggered just by being in the same area where the accident occurred. So, this is why it is impossible to know what constitutes a traumatic experience for every person because it's going to be different. Objective characteristics are those elements of a traumatic event that are tangible or factual. Subjective characteristics include internal processes such as perceptions of traumatic experiences and the meanings that are assigned to them. So, trauma is subjective by nature. So it's not always the circumstances of an event that determine whether it is traumatic for a person. Instead, it's important to look at the subjective emotional experience that a person had in that moment. The emotional experience of an event, not just the event itself, is going to determine whether it's traumatic or not for an individual. A person's personality, their history, their circumstances, and even their support system all play a role in how they are going to react to a potentially traumatic event. What one person finds to be traumatic, another person may not. Why does PTSD develop and how can we help individuals to cope with it? So, not everyone who lives through a dangerous event goes on to develop PTSD. Many factors actually play a part in that. So, some of these factors are present before the trauma, while others play a role during or even after a traumatic event. So, the exact causes of PTSD are complex and involve a combination of factors, including survival mechanisms, high adrenaline levels, and changes in the brain. If a person had depression or anxiety in their past, or if they do not receive much support from family or friends, they may be more likely to develop PTSD after a traumatic event. So let's look at survival mechanisms. So, according to mentalhealth.org, the symptoms of PTSD could be caused by an automatic survival mechanism that's intended to help survive further trauma. So, look at flashbacks. So, flashbacks force a person to relive the events in detail so that they're prepared if it happens again. So, while in theory this is intended to help you survive, it actually stops people from processing trauma and it stops them from being able to move on with their life. PTSD could also develop due to high adrenaline levels. So, people with PTSD have been found to continue to produce high amounts of fight or flight hormones, even when there is no danger. High adrenaline may be responsible for the numbed emotions and hyperarousal experienced by some people with PTSD. Changes in a person's brain can also cause PTSD. So, one part of the brain responsible for memory and emotions is known as the hippocampus. In people with PTSD, the hippocampus appears smaller in size. Changes in this part of the brain are related to how a person perceives fear, anxiety. It affects their memory problems and their flashbacks. So, the malfunctioning hippocampus may prevent flashbacks and nightmares from being properly processed. So, the anxiety they generate does not reduce over time, and that can lead to PTSD. So by now you may be thinking, well, how can I help a person with post-traumatic stress? So here are some things that you should do when you're helping, okay? So it's important to remain calm and to be patient when helping someone during a PTSD episode. You want to listen carefully to what the person is saying and try to understand their perspective. You want to create a safe environment by removing any triggers that may be causing some sort of distress. If there are too many loud noises or if there are too many bright lights, if possible, just move to a quieter location where the person can feel safe and they can feel more secure. You want to offer social support by letting the person know that they are not alone. You can offer to stay with them, or you can call someone that they trust, like a friend or family member, that can provide additional support to them in that moment. So let's watch another short video on some tips to help someone dealing with PTSD.
So like I said, today I'm going to talk with you about how to help a loved one who's struggling with PTSD. I've heard from many of you that you have family members who have either gone to war or have been in some kind of traumatic event. It could have been a car accident. It could have been a sexual trauma that they've just now started opening up to you about, and you wonder how you can better help, which just shows how amazing our community is. Am I right? That we're all looking to not only help ourselves, but to also find ways to help those who we love. And today I have 4 quick tips and tricks on best ways that you can help them. The first is be patient and understanding. And I know that kind of goes without saying, but I find that a lot of people who struggle with PTSD and their loved ones have a hard time understanding where the other one is at. Overcoming PTSD can take time. It can be really hard. We can feel like we're making like all these steps forward and then we slide back a little bit. It's like I always say, it's a process, not perfection, right? And so it's important for us to be patient and understanding with their process versus maybe yelling at them like, hey, stop rehashing the past. Why do we have to talk about that all the time? And understanding that that's where they're at the moment. They need to talk it out so that they can move on and continue moving forward. The second way that we can help is to try to be aware of their triggers. A lot of people with PTSD have certain triggers that will cause them to go into a PTSD-like response. And being aware of that and working to avoid them or offer extra support during that time can really help. Triggers can be anything from, like, let's say loud bangs are really hard for them to manage. Maybe we avoid that 4th of July party with all the fireworks. That might be a little much for them. Or maybe it's an anniversary of a certain thing, or maybe it's, going to the ocean. It could be any number of things that trigger that experience in them, and being aware and asking them about it and helping be there for them for some extra support during that time and during those triggers can really, really help them along. The third and most difficult is don't take post-traumatic stress disorder symptoms personally. I know it's really hard. A lot of the common symptoms include isolation, not avoiding intimacy, all sorts of things that if we're in a relationship with the person, it can be really hard. We may be calling them and they're not calling us back. We may have had plans and they didn't show, or they canceled last minute. This may be our husband or wife and they don't want to have sex with us for weeks on end and we don't understand. Is it us? What happened? And we take it personally. Now, I know it's hard to not, but the best thing that we can do is seek to understand. Talk with them. Say, I'm feeling this way. I know it may be part of your process, but this is part of my process. And working together to start communicating about each other's experience. This really isn't anything about you. This is something they're going through. And the more we seek to understand, the better support we can be for them while they're working through it. The fourth and final tip is to not pressure your loved one into talking about it. I know it's hard and sometimes we want to hear all about it and want to be there for them. And that's part of the reason why they love us and it's why we love them, right? We have this great relationship. But having PTSD can make it really hard. And talking about things can be really uncomfortable. And so I find the most beneficial thing you can do for them and their recovery is to just let them know you're there. It's like anything. We want to kind of touch base with them and check in. We don't want to hound them. We don't want to force them. So you may say, I've noticed that you've been a little irritable today and withdrawn, but I'm here if you want to talk. Just reminding them you're there. They may want to talk, they may not. But it can help for them to just know that they have support. So keep these things in mind. I know that it's difficult. I know it's hard to have a loved one going through this. I know that a lot of things we take personally and we think are our fault. But know that they're going through a really difficult time. And the best thing you can do is just be there for them. Check in. Let them go through their process at their own pace. Because they will come out of it. Know that you can recover from PTSD. This doesn't have to last forever. So please share this video if you know someone or if you think someone that you know has been involved in a traumatic event. The more we know together, the better. So like this, share it, share your experiences below, and keep working with me towards a healthy mind and a healthy body.
All right, those are some great tips to help someone cope with PTSD. So let's further that conversation, okay? So your caring support after a traumatic event may make a big difference in how well and how fast a person recovers. So you'll want to educate yourself, okay? People who struggle with PTSD, they often do so in isolation because they find it hard to reach out. By learning about the condition yourself, you can now have the words to more clearly explain to others what's happening, or you can even encourage that person to ask for the help that they need. Find supportive connections. So there are many resources offered in local communities and online that offer group-based support, such as support groups, classes, community meetings, and online groups. Connecting with others who are going through a similar experience can help to break down the walls of isolation and to help people to understand that they're not alone. So strategies that can be considered when coping with symptoms of PTSD um, are some that you see listed here. So people who are diagnosed with post-traumatic stress disorder, they can live a very fulfilling life. However, it is imperative to seek out professional treatment. Every person is different when dealing with PTSD, so everyone's management strategies are going to vary. But you still want to encourage people to consider therapy. Maybe you can consider or get them to consider medication or lifestyle changes, because that can help with symptoms that are related to PTSD. It's important to seek out safe people to connect with who can support in the recovery journey. Build an effective support system that includes a mix of trusted individuals like supportive family and friends, peer support groups, whether it's in person or online, and mental health professionals like therapists or case managers. Building a network that helps with daily tasks can provide a sense of community through shared hobbies and activities. Avoid using substances and other negative coping strategies to self soothe or to self medicate. Make sure people are getting enough rest, at least 8 hours of sleep each night, and decrease caffeine intake. One of the most important ways to cope with PTSD is to take care of your mental and your physical wellness. So, you want to practice self care techniques when feeling overwhelmed. So, do something like getting a massage or engaging in positive self talk, going for a walk, things of that nature. Identify triggers that may cause stress and make sure you're developing um, emotional regulation techniques to deal with those. Practice relaxation techniques like deep breathing, prayer, meditation, or even try yoga. Incorporate exercise into your everyday routine. Make sure you're eating a balanced diet. Um, Practice reframing negative thoughts as they come up. There are many strategies that can work together with treatment to not only help cope with PTSD, but to strengthen a person's mind and body. Before we end today's training, let's quickly discuss vicarious trauma. Vicarious trauma can be a pathway to developing PTSD, and many of the symptoms actually overlap, such as intrusive thoughts, emotional numbness, sleep disturbances, irritability, and even relationship problems. The key difference is that vicarious trauma comes from exposure to another person's trauma, whereas PTSD is a direct response to one's own trauma. Now, that leads us to the question of who can be affected by vicarious trauma. According to the National Institute of Health, providers are particularly vulnerable to vicarious trauma due to their consistent exposure to trauma narratives. Loved ones and those who have experienced trauma can also develop vicarious trauma from supporting their family member or their friend. Vicarious trauma can cause a range of effects on workers. Therefore, you must be aware of what symptoms you should look for within yourselves. So, some things you should look for would be if you're starting to have some difficulty separating your work life from your personal life. Maybe you start to withdraw and isolate away from your colleagues or even your personal relationships. Maybe you notice that you're a little bit more irritable these days, or you get angry more often, and it leads to some unwanted outbursts. Maybe you notice some changes in your eating. Maybe you typically eat very healthy, and now you're noticing that you're snacking more or eating more of the junk foods that you typically wouldn't eat. Or maybe even there's a change in your sleeping habits. Maybe you're sleeping too much or too little. Increased substance use. So whether you never use substances and now you find yourself, drinking or engaging in some other type of substance use, or maybe maybe you did it socially and now you're noticing that you're doing it on a very regular basis. When it comes to your job, you could see an increase in your absenteeism where you're not showing up every day, or when you do show up, maybe you're late. Or you could experience a situation where maybe now you're just changing jobs quite frequently, or maybe you could have difficulty maintaining professional boundaries. So, when it comes to vicarious trauma, that can lead to burnout and a significant negative impact on personal relationships and your professional performance. Self care for vicarious trauma involves a combination of strategies. First, there are emotional and mental strategies like mindfulness, setting boundaries, and processing emotions. Then there's physical self care where you prioritize sleep, you maintain a healthy and balanced diet, and you increase your physical activity to boost your endorphins to improve overall well being. Then there's social and professional self care. Make sure to maintain connections by spending time with your family and friends who are not in crisis. You want to make time for activities that you enjoy outside of work so that you can bring balance and joy to your life. And seek professional support by engaging in regular supervision with your colleagues or with your supervisor so that you are able to debrief and process difficult cases. And lastly, just consider seeking your own therapy as well. There's no shame in seeking mental health treatment. So that's it. That concludes your training on PTSD. Hopefully, you found something to be beneficial. Thank you for participating today. Have a great day.